Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider, and this is part of our conversation, our continuing conversation about training the active aging population, and specifically with rotator cuff issues. So impingement type syndromes, tears, and or labral issues. In the series so far, we've been walking you through the integrative movement system, the strategic process we take all our clients through here in our clinic, Chicago Integrative Movement Specialists, and also that we teach as part of our certification courses, the Integrative Corrective Exercise Instructor Program, as well as the Integrative Movement Specialist Certification Program. We've also shared with you the principles along the way of the integrative movement system: alignment, breathing, control, because we believe when you give your client a more optimal strategy, an efficient strategy for aligning, for breathing, for controlling, you set your client up for success and teach them a proper way, a more optimal way of stabilizing and holding the whole entire shoulder complex. Now, more specifically, we're going to move into the rotator cuff itself. But the reason we set you up along the process and with the principles is so that you understand that the rotator cuff is reliant upon what happens around it. So the head, the neck, the thorax, as well as the shoulder complex itself. So don't address the rotator cuff specifically until you make sure the client is aligned well, they're breathing well, and they're controlling the shoulder complex well, which is why I shared with you a very simple assessment as well as corrective exercise strategy in the last two videos. And you can access them here on Facebook, as well as our YouTube channel, fitnesseducationseminars.com, and our website, iihfe.com. And be sure to sign up for our newsletter, Integrative Movement Insider, because we share these videos through each of our weekly newsletters, so that way you stay informed about working with your active population. Now, specifically, we're going to be purposeful about the rotator cuff. And we also want you to understand the ABCs, the other ABCs, anatomy, biomechanics, and motor control. Because if you understand anatomy, what the function of your rotator cuff is, for example, you understand the biomechanics of how the shoulder works, and you understand how your nervous system, how your brain and nervous system control, the C is control, motor control of the shoulder complex, then you understand why we choose the exercises we choose, and maybe don't do the exercises that commonly are performed in our industry. One of the questions that we often get before we get into the specific rotator cuff muscles, the anatomy of it, is when you're demonstrating your exercises, are you packing the shoulder? One of the reasons we don't pack the shoulder is because that's an effective strategy if you're dealing with a football player, a wrestler, a boxer, maybe a power lifter. But if you're working with the active aging population and they're not doing those activities, they don't need to pack the shoulder. And if you look at a lot of your clients, their shoulder's already packed. It's packed in a bad position. And if you say, hey, let's just pack it in a better position, that's not better. Packing is packing. Packing is too much compression. It's over-compression of the shoulder complex. It's over-compression of the neck and upper rib cage. It will inhibit proper shoulder motion as well as breathing. So make sure you teach your client how to better align, better breathe, better control, that I shared with you already, and that will continue in the next part of this video. But now let's discuss the rotator cuff specifically. So I'm going to have my assistant, Sarah, come on out. She's not really my assistant. She's my colleague, my friend, and also teaches here at our facility. So she's going to help us demonstrate the rotator cuff. I'm going to give you the down and dirty version of the rotator cuff. So if you look here, here's the right scapula. You have four specific muscles that make up your rotator cuff. We can also add a fifth one, would be the biceps brachii, but we'll leave that out of this discussion just for today. Your supraspinatus comes off the top of the scapula, the supraspinatus fossa, to insert into the lesser tubercle. I'm going to go really quickly so that way you can watch it again in slower motion, so that way you get the concepts. But I'm going to go real quick so you have all the information. So the supraspinatus comes from the supraspinatus fossa again, comes underneath this bone here, the acromion process, to insert on the top side of the shoulder, which is the lesser tubercle, or I should say the greater tubercle, not the lesser tubercle. Now your infraspinatus comes right below the spine, comes from right below the spine of the scapula to insert right below the supraspinatus on the backside of the head of the humerus. And then your teres minor comes off the lateral border of the scapula to insert right below the infraspinatus. Teres major will also come off the scapula there as well, but it's not part of the rotator cuff because it doesn't blend up into the joint capsule and or connect specifically up into that same area as the rest of the rotator cuff. I'm going to have Sarah flip around just a little tiny bit, right there. Now your subscapularis, the fourth of the rotator cuff muscles, inserts off the subscapular fossa on the front side of the scapula. It comes around and inserts into the front side of the shoulder right about here, right below the lesser tubercle, or actually into the lesser tubercle of the humerus, in the inside of that intertubercular line. Now, The most important thing I want you to understand about the rotator cuff is its function is stability of the ball on the socket. That's its primary function. It's part of that deep myofascial system that we discussed. The deep myofascial system, its role is to activate and hold the ball on the socket, hold the ball on the glenoid fossa of the scapula, so that way before you move your arm, before you load the arm, that the glenohumeral joint, that ball and socket joint, is stabilized. So prior to movement, as Sarah brings her arm overhead, we want the rotator cuff to stabilize the head of the humerus into the glenoid fossa or into the socket of the scapula. So that way the ball and socket stays stabilized. So that way if you are pressing overhead, Sarah stays nice and stable and the joint is controlled in this range of motion and through all the functional patterns that we do. Thanks so much, Sarah. I appreciate it. So, you have your 4 rotator cuff muscles: Supraspinatus, Infraspinatus, teres minor, and Subscapularis. They function collectively to help position the ball relative to the socket, the glenoid fossa of the scapula. It stabilizes by pre-activating prior to motion to create optimal stability, so that way when you move, when you stabilize, when you do push-ups, pull, all your pulling patterns, that your joint is stabilized. Now, next week, we're going to come back and discuss what we should do and what we shouldn't maybe avoid and or modify around the rotator cuff, because there's specific strategies that we've all been taught that actually contribute to rotator cuff dysfunction or non-optimal function of the rotator cuff. So we'll discuss those exercises and we'll discuss how you best train the rotator cuff to do its job, which is to stabilize that ball and socket joint. So thank you. There's a lot of information in this video for you. Please go back, review it, take notes. There's a lot of information in here, and we'll be sharing more information on the rotator cuff next week. Make it a great day, make it a great week. Get out there and empower your active aging population to be more active, to really understand how to use their body, and attract more individuals that need, want, and will come to you for your expertise. Take care. We'll talk to you soon through Integrative Movement Insider. Make it a great day.